We're going to do a deep dive on our contract at Southern Health Foundation Trust. We've got our client, Bob, with us today, and we're going to explain to you from the NHS England team perspective how we've worked collaboratively to enable to us to support our client in achieving exemplar status, and then we'll take a Q&A at the end of the session. So I'd just like to introduce our panel team. My name is Lauren Davidge-Stringer. I am the Head of Marketing at MediRest at Compass Group, and I'm here just to facilitate the session today. The real heroes who are here to talk to you directly are our panel team. So I'd just like to introduce to you. First of all, Emma Brooks was due to be here with us today, and unfortunately, due to unforeseen circumstances, she's not able to be here. But Emma needs no introductions in this room, I'm sure. She is the Head of Soft FM Strategy and Operations at NHS England, and she is the lady behind the National Cleaning Standards of 2021. She's also instrumental in the accreditation of exemplar site status and that audit process. Emma has left us some slides today, and she's provided information which Anna will share on her behalf. So that leads me on nicely to Anna Hallas. Anna is our Head of Cleaning and Infection Control at MediRest. If there's anything to be known about cleaning, Anna is the lady that knows. So you can be rest assured we're in safe hands discussing this with Anna today. Anna also sat on the team that actually wrote the National Cleaning Standards, so she is well versed in everything to do with those standards. And I know that Anna doesn't really like us to mention, but it is kind of instrumental and a fantastic accolade to her expertise. She was actually nominated by the NHS for an MBE, which she was awarded for her work during the COVID pandemic. So I think that just really backs up Anna's expertise in this field. But she's very keen and passionate that we don't dwell on that today, and that we really do focus on our client relationship and our fantastic client, Bob, and everything that we've worked with Bob on. We've got Callum Lane here today. Callum is the contract manager at Southern Health. He works for MediRest, and he's also our cleaning SME working under Anna. Callum's our gentle giant in MediRest, as we like to call him, and he's instrumental in implementation of robotics at MediRest, and also in supporting the teams that have gone for the NHS Exemplar accreditation. So he was part of the team that supported the Royal Surrey contract, and obviously more recently at Southern Health. And then we've got Bob Beeching here today from Southern Health Foundation Trust. And Bob's going to tell us from the client's perspective what it's been like to be part of the trust that has managed to achieve exemplar status for cleaning. So I'm just going to give you a brief overview about MediRest. So who are we? What do we do? So at MediRest, we work with over 20 NHS trusts across the country. We're really proud to have over 10,000 employees that are dedicated to facilities management services. And we call them our healthcare heroes. They are our frontline teams. They are delivering these standards every single day. We do provide a variety of soft FM services to the healthcare industry, including but not limited to cleaning, of course, catering, portering and security. We've also worked, we've been on a bit of a journey over the past 18 months, 2 years, working very closely with the NHS England team to really understand the cleaning standards and how we use those to become accredited as exemplar site status. So we've been able to really go on a journey with our client teams to support them in achieving that. And that started last year. We worked with our client partner at the Royal Surrey, and they managed to achieve triple exemplar site status for portering, cleaning and catering services, and they were the first trust to be able to achieve that standard, which was a fantastic accolade. And then earlier this year we worked with our client team at the Barnet Hospital, and they also achieved triple exemplar site status. And more recently, and what we'll go into detail today, is obviously our Southern Health contract and their exemplar status for cleaning services. Now I'm going to hand over to Anna, who's going to go through what does it really mean to be exemplar site status from the NHS England's team perspective.
Oh, morning everybody. I think it's a real testament to the implementation of the standards and actually seeing how they've been delivered in practice. So it's looking at not just, Lauren's talked about the exemplar status at the 3 sites, Royal Surrey, Barnet, and their triple exemplar status. And obviously we're looking today at cleaning with Southern Health. But actually it's about the implementation of all of the different standards and actually being able to see those in practice. It's about being able to show the relationship, because relationships matter, don't they? It's very important that you have these really good mature relationships where you can actually grow and develop services, and seeing that in action is important as well. So the process was very much started and owned by Emma Brooks. It is currently about the 3 services. It's likely to be expanded to other services in the future. But it is all about the partnership working between all levels of the organisation. So that's the important thing, is to be able to show that you're working in partnership, show how the standards have been implemented and show them working in practice, and show the ethos of continuous improvement, which is a tenet of the NHS. So it's about demonstrating those standards in practice. It's about making sure that you've tailored them to meet your own requirements. It's about showcasing best practice and actually being open to trial and test different products and processes within the organisation. And it's also about sort of being open to having other trusts coming along and talking about how they've gone on the journey and how they can help and support other people to go on the journey. So it's really not just exemplar as in a certificate that the trust receive. It's also about living and breathing those standards and actually helping and supporting the whole of the NHS.
And it's important that there's a whole organisational approach, isn't there, that it's sponsored at a high level.
It absolutely is. It needs to be driven really by the board, so it needs to be driven at the very highest level, as all of the standards have to have board representation and somebody who's advocating for the services at trust board level. So it is really a whole organisation approach. From a cleanliness point of view, it's obviously important that cleaning is everybody's responsibility, and it's about making sure that that is sort of delivered and that ethos is carried through all of the different sites, and that's visible because it's really important that we all work together to achieve and deliver the standards. We understand what's important to each other. All of the sites vary, all of the different services that are provided vary. And it's about making sure that they're tailored, they're communicated and implemented. But yes, definitely a whole organisation approach. And ultimately, it's about being a flagship for the NHS and supporting the NHS programme to actually improve and continually innovate.
Fantastic. So next I'd like to lead on to yourself, Bob. So it's really time for us to get under the skin of Southern Health Foundation Trust and kind of hear that from your perspective as a client. So can you just tell us a little bit about the trust, how that's made up, your sites and kind of the services that we support you to provide?
Yep, certainly. So Southern Health NHS Foundation Trust is one of the largest mental health trusts in the United Kingdom. We cover the whole of Hampshire, ranging from Fleet right up in the north, all the way down to the south coast, across to Petersfield in the east, and down into the New Forest, down to New Milton. We are also, as of the 1st of May, expanding onto the Isle of Wight and taking up some sites over there. We are an extremely diverse trust. We're called a mental health trust. We have older people's mental health, we've got adult mental health, we've got forensic mental health, we've got learning disabilities, but we've also got a lot of community staff. So we've got district nurses, we've got health visitors, we have GP surgeries, we've got medical centres, you name it, we've got it. We've got urgent treatment centres, we've got minor injuries units. There's not a great deal that we don't cover. In fact, in one of our hospitals, we've got a couple of operating theatres as well. So we do cover the full gambit of services, and we actually utilise all 6 of the risk categories across the whole of the trust in various ways and means. So, yeah, very diverse and very widespread sites as well. I think we actually operate in something like 300 sites if you take into all the little village halls and stuff that we go into to provide sessions. And MediRest are serving 60 sites for us on a daily basis across the Hampshire and Isle of Wight patch. So yeah, it's quite a big task getting around there and looking at all the different buildings, different services, and each one having its own unique requirements. It makes for an interesting life.
Yeah, I'm sure. Could you maybe just talk to the audience about a little bit more about the 4 sites that were specifically visited by Emma Brooks and the team when they were doing the accreditation process and the diversities between them?
Certainly, yeah. So although we're saying 4 sites, it was actually 5 units we visited because one is part of a campus, or sorry, 2 are part of a campus. So we started off with Gosport War Memorial. It's a hospital down in Gosport formed in the 1914 period out of the First World War, so it gives you sort of some indication of the history of the building and how long it's been there. So within Gosport War we have 2 older people's mental health wards with functional dementia patients in them, and we've got 2 community physical health wards with patients recovering from strokes and et cetera up in there. We've got the urgent treatment centre, we've got the minor injuries unit, we've got dental, we've got outpatients mental health coming in, and we've also got a GP surgery attached to that building as well. So Gosport War, busy site, and as I say, very differing needs across all the wards. Melbury Lodge up in Winchester sits on the main hospital site up there, but is a completely separate unit. Again, we've got 3 different types of services in there. So we've got OPMH ward, we've got an adult mental health with male and female patients, and we've got a mother and baby unit downstairs. And again, all completely differing needs, all with different requirements, different types of cleaning required, et cetera. So that's those sites. Parklands, again, a mixture of OPMH and adult mental health with a very secure wing, and on that wing we also service 4 Ministry of Defence beds for servicemen suffering from issues at the same time. And then we move down to Tatchbury Mount, back down at Totton near Southampton, where we've got Southfield, which is a low secure forensic unit. So forensic units provide their own challenges. The types of patients in there are sometimes quite challenging. And then we last looked at the learning disabilities rehab unit for young adult males. So a wide range of services spread across the patch that we looked at.
Fantastic. And could you perhaps just tell us a little bit more about the partnership between Southern Health and MediRest and how that's led to your trust becoming one of our centres of excellence?
So we've been working with MediRest since 2015, and they've come to understand our business. We understand them, and we don't see MediRest as an outside contractor. They're just another part of the services working within the trust for us and with us to provide the best cleaning and environments that we can for our patients. So we work together, we resolve problems together, and we look at it as very much as a partnership. You know, some outside contractors can be beaten up by the client, and that doesn't get anybody anywhere. You have to work together to understand each other's needs and to find the solutions to the common goal that you're aiming for. You know, at the end of the day, they want to provide a good service, we want a good service, and so therefore we work together and resolve issues. And as I said, you know, all the cleaners in the sites, they think they're just part of the staff, and the clinical staff think that the MediRest team are part of the staff as well. They don't see them as outside contractors. They're just, you know, very proud of what they do on each of the wards, and they see it as their ward, their environment, and they come in, and I sometimes think they forget that they work for MediRest as well. So I think it's fantastic that we can achieve that.
Yeah. Well, I'm sure that everyone in the room is thinking the same as me. You know, it's a really complex contract, and it's really incredible to hear about that from your experience. So I think we did rock up to Bob's site last week with a camera crew, and we did take some camera footage of your teams, both Callum and Bob's teams, and we'd like to share with you today a video from the site and actually from the frontline team and their experience of being involved in being accredited for Exemplar site status with NHS.
Southern Health NHS Foundation Trust has been awarded Exemplar site status for cleaning here at Gosport and at some other locations across the contract. This means that they are the gold standard for cleaning in the NHS.
To achieve this point and be the first mental health trust to get the NHS Exemplar status is a fantastic reward for all the hard work that's gone in from all of the teams. Working with MediRest is a big part of this, so I think for both of us it's a very huge achievement and one that we're both quite rightly proud of.
It's so exciting. We all work hard really. I'm so proud of being a member of this wonderful team. I feel so happy.
First of all, we had to implement the new cleaning standards, but MediRest we went above and beyond and we introduced positive impressions, which is our customer satisfaction training for all of our frontline teams, management teams, and even myself. That was adapted for a mental health setting, and we had to make sure that every single unit were following that set standard, whether it be from, in terms of risk category, FR1 risk category down to FR6.
We have regular meetings with clinical teams. We have the MediRest supervisors and the managers going around and meeting with the site managers for the trust on a regular basis. Weekly meetings take place so that any problems can be headed off and addressed. It is a joint approach and everybody is working together to achieve a common goal.
In terms of innovation, we introduced UVC cleaning here at Gosport, which is contributed to the fact of having no reportable infections here at Gosport.
The UVC machine, it makes us, although we always clean the patient's room when a patient has been discharged, it gives us that extra bit of confidence to know that the next patient is going into a very clean room.
We've had scrubber dryers, we've had sweepers for the hospital, which are used mainly at night for the porters. We also have a robot, which has been key, and that goes up and down the corridors every day. So that's a really good thing.
Since introducing the new cleaning standards here at Southern Health, we've had some fantastic feedback from the clinical teams and from the patients themselves. They both feel reassured that by having these new standards in, that they are in a clean and sterile environment, and that is backed up by, in some places, that they've got the 5-star rating.
For the Trust, achieving NHS Exemplar status has been a huge feather in our cap, and we're quite proud that we've achieved this status with MediRest and are moving forward and able to lead the way across the NHS.
Well, that's really lovely to see, Bob. And, you know, you've got a fantastic team there. You must be immensely proud.
Yeah, we are. As I said in the video, it's a real feather in the cap for the Trust. I think it's a vindication of the power of partnership between ourselves and MediRest. We've been with them 8 years, as I said, and now we're at a stage where we have full confidence in them, and we've introduced these new technologies. We've looked at the UVC machines, we've looked at the robots. We're now moving on to Sano and non-chemical cleaning. We're exploring, I can never say this, the HOCl, Cockle, yeah, the acids. And that's backed up by our infection control team, who are trusting enough of MediRest and myself and the abilities that we bring to move forward and look at new innovations and lead the way in cleaning standards. You heard me say we're joining up with the Isle of Wight. We're also joining with Solent to form a new trust very soon. And we're looking forward to being able to take what we've learnt and what we practice on a daily basis out to those trusts and bring them forward in our journey as we move forward as well with new technologies.
Fantastic. And Anna, I wondered if you could just talk to us a little bit more detail. Obviously, you were at the site visits with Emma Brooks. Can you perhaps tell people in the room what typically is it that Emma's looking for when she's on a visit, and kind of what it shows her that they're embracing the standards?
Well, we've produced a booklet that we've done in partnership with the Trust, so that it explains the journey that we've been on in terms of the work that we've done together and how we've implemented the standards, and some case studies of different ways of working, and things like the Tassano have been included in those case studies. So there's been some work around providing some pre-information to actually explain the whole partnership. And then the actual site visits, Emma comes along on the day and looks and goes out and meets some of the team. So many of the team that you saw on the video, Emma went out and met, walked around, had a look at the processes that we're following, a bit like doing an efficacy audit, and actually really sort of talked to the staff, talked to the clinical teams, and could see in practice that partnership working, and she could see all the standards in place as well. So the commitment to cleanliness posters being up, the star ratings posters, and all the other signage, as well as actually seeing in operation the standards working in a mental health environment. And I think the other thing that was important on these specific visits was looking at the differences in the different sites and how the standards have been tailored to meet those different sites. As Bob's explained, we went to 4 sites and 5 different types of services, and it was important to see how the standards have been adapted and actually are working in practice in those different areas.
Okay, great. And obviously you were part of writing the national cleaning standards. How do you, or how have you made sure that that is transferred to your MediRest role and the wider team at MediRest, and then how we kind of share that with our clients across our portfolio?
So when, I mean, I think quite a few of my colleagues in the audience were also involved in the development of the standards. I can see a variety of people here today. It's nice to see you all too. But it does give you an opportunity to really understand in detail what the standards, the ethos of the standards and how they work. So we provided training documentation, we did lots and lots of webinars and communication to explain how they worked. We opened ourselves up to providing whatever support people needed, however much or little, to support the change of the standards. And we developed some of our target operating models to make sure that we could translate from what we currently do or what we did previously to what we're doing now, to make sure that we understood and the clients understood all the implications of those. But for me as well, it's a two-way process. So we were also able to take our experience of working with people like Bob and Callum at Southern Health to actually to make sure that the standards delivered what was needed in all of those different environments. So it's very much a process of, you know, so giving and receiving, if you like.
Okay, thank you. I think it's time now that we kind of dive more deeply into Southern Health and from Bob's perspective as a client, how they've embraced the standards. So, Bob, when you implemented the 2021 standards at Southern Health, can you just talk to us a bit about what was the Trust's strategy and kind of the processes to get that implemented?
So, like many people, we'd awaited with bated breath the launch of the new 2021 standards. And once we got the documents and we started looking at them, we formed a committee led from the top from our Estates Director, and utilising the knowledge from MediRest, we invited them into partnership. We invited our infection control team, our clinical teams, and a variety of other people from around the Trust onto the panels to discuss what we were going to do and how we were going to implement it. So we started off by looking at our roles and responsibilities and looking at the new standards and matching our roles and responsibilities, ensuring that everybody in the teams would know who was supposed to be cleaning what. So the clinical teams cleaning their areas and their pieces of equipment, the housekeepers doing theirs, and where required we adapted it and changed it to meet our requirements within our Trust and what we felt was right for us. We utilised MediRest. You've heard me talk about how big the Trust was and how diverse it is. There's a lot going on in our Trust with changes, building, teams moving, etc., etc. So trying to keep track of what's happening on a day-to-day basis is very difficult. So we utilised MediRest knowledge of the sites just to cross-check that what we thought was happening in each of the sites and on each of the wards was what was actually going on. Using that knowledge, we were then able to match our risk categories to those areas and ensure that we were putting the right risk categories into the right areas and that the information that we had was correct. When we looked at some of the risk categories, we felt that they weren't quite robust enough, especially in the lower risk categories, the 5s and the 6s, and especially around the staff areas. So we decided to tweak some of those and put in some enhanced cleaning, which gave us a cost implementation, that's the word. But we were okay with that. We felt that it would deliver what we required over time and was better for the trust and for what we needed moving forward. And then blatantly stole documentation from MediRest to use as the charters, the cleaning standards, some nice pictorial diagrams that showed the roles and responsibilities of everybody. But they were very happy to share that with us. So then we gave ourselves time. So we implemented the standards on the 1st of April 2022. And the first thing we did was we looked and said, okay, we're going to carry out our technical audits, but because we changed the process slightly in MediRest, we're now responsible for delivering the technical audits solely. We said what we will do is we will carry out the audits for the first 3 months, but there'll be no penalties. We won't, we won't implement any KPIs. There'll be no backlash if it's not right, because we knew that we had to phase the approach. We had to ensure that the information that we'd all put together was correct. And so we gave ourselves 3 months of just to reevaluate where we were. And then within 6 months, we were introducing the efficacy audits, and we launched those with my very capable auditor, Jane Horlock, who's with us today, going out and starting to carry out the efficacy audits to prove that what we had put in place was there, that we'd got the cleaning schedules up, that we'd got the commitment to charter posters up, that the star rating posters were being introduced properly, and that the teams had embraced the new standards properly, and everything was working as we hoped. So yeah, bit of planning, but yeah, we're quite proud of the way it turned out.
And Callum, how did your team support to deliver that strategy and kind of the outputs for that?
I'd love to turn around and say to you, yeah, we did it from day one, but we absolutely didn't. We, and Steve, who my predecessor, was given a book. No, we weren't. We tried to sit down with the trust and understand every single one of their units, every single one of their wards, every single toilet, every single bay. We needed to understand what actually underpinned the trust. Yes, we've been in partnership with 2015, but as Bob said, we could go into a unit tomorrow and it'd be completely different from what it was last Monday. So by having that open communication and what was available to us, it really did help us deliver that. And then once we embedded from obviously 2022, beginning of 2023, we started looking at how can we further enhance this. And by the end of 2023, we managed to start rolling out positive impressions, which is our customer service training. That went to myself, it went to the managers, and then from January we started looking at doing the front line and rolling it out to them, because it gives them the sort of the confidence that they can go into any situation in the trust and not only deliver the cleaning standards, but also any situation that they may face in the ward, which can vary from every day to day.
And that's important, isn't it, because of the different service users that you could potentially have in that type of environment?
Yeah, definitely.
Yeah. Great. And how do you ensure that that's delivered consistently, and how is it measured?
So I sat down with Bob. We do it every quarter. We look at a roadmap, and we decided that we would look at four key pillars. The first one being training. It's rule number one. They have to be trained to be able to what they do. So they will train on SOPs and best practices. The second one is the schedules. We reviewed every single schedule. How many schedules have we got, Bob? Too many, but they get reviewed on a yearly basis, or if the area changes. The third one, as I've alluded to, is the communication. We really do have a really open communication with the trust, where I know I can walk onto a ward or into a GP surgery and have a conversation with the clinician and say, look, this is the issues we're facing, can you help us? And I can hands down say that they will turn around and say, yes, we will absolutely help you. And the final one is continuous improvement. So as Bob said, we have a strict technical audit regime where my auditor, and will be joined by a new auditor soon, does around 80 technical audits a month. But again, it's underpinned by the efficacy audits that Jane does, where every 6 months we do about 100 efficacy audits across the trust. And I think they did one yesterday, and it got 98%. So I'm really proud of the journey and the help that I've had.
And all the audits that are done, the technical audits are always accompanied by a clinical member of the ward, or if they're not available, then by the site managers. And the efficacy audits are always accompanied by our IPCC leads for those areas. So overall, we have everybody understands what's going on. There's nothing hidden, and everybody's contributing to what's happening with the audits.
Callum, could you explain to the room what tools are required to deliver the standards and to showcase innovation when being accredited by NHS England, and what's the toolkit look like for MediRest?
So the toolkit that we have at MediRest is the toolkit that everyone else has access to. So we use the roles and responsibilities poster that is very pictorial and very colourful, and it's up in every sluice that I can think of anyway, where it displays who does what and when they do it and how they do it. We have a frontline team that I would like to say is consistent, but we do have new starters every now and again. So by them having that visual poster, it does help them as well. But one that I'm personally proud of, outside of the robots, which obviously we've said as well, is the UVC tool that we introduced at Gosport. Whilst Emma was going around, we were sort of corralled by the infection control team there, and I didn't pay them to say this, but said that the reason that they had no reportable infections, and that was down to the UVC machine, and that's something that I'm personally proud of.
Impressive. Bob, how did you take this as an opportunity at the Trust to reevaluate and invest in your cleaning services?
You've heard us saying how we started this progress. As we've moved forward with MediRest, it is enabling us to look at new systems, look at new ways of doing things. We've got sustainability in mind, so getting rid of chemicals is great, but also because of the types of unit that we have with severe mental health patients, and for patients who are quite open to self-harming and everything, anything that we can do to reduce chemical usage, to get rid of any dangerous substances on our wards, is a major step forward. So we're really happy to work and trial new techniques, look at new ways of doing things, and just constantly check that what we're doing is the right way of doing things and is the best way of doing things. It's very easy to just sit back and go, well, yeah, I'm passing every audit every month. It's great. I don't need to do anything else now. But actually, you need to move forward. You need to adapt and to look at new ways of doing things. As I said, some of the things we've seen here today we want to bring forward, and there's probably a lot more else out there that we would want to get involved in, but we've got to be careful we don't overdo it.
One thing at a time, Bob.
Yeah. What difference have the new standards made to the Trust?
So the new standards have really helped us to have confidence in the cleaning, and to give confidence to our clinical teams and to our staff, and more importantly to the patients and the visitors that come into the hospital. We have a lot of patients who are with us for a long time in mental health, and they can be almost years on some of those wards. And so it's not just a ward or a hospital, it's their home, it's where they live, it's where everything for them happens. And so it's very important that they have a clean, safe environment for them. Having a clean environment is enormously helpful for people's mental health, and if we can contribute to making people better, then that's what we need. That's all it needs.
So Anna, I know that you've got something with you today that you'd like to share with Bob on Emma's behalf.
I have. I'm very proud and pleased to be able to present you, Bob, with this amazing Exemplar site certificate. So
That's
thank you
great.
very
If
much.
anyone could
Thank
join us
you.
in a round of applause. Unfortunately, obviously Emma wasn't able to be here today from NHS England, but she would have loved to have presented Bob with his certificate for the Trust today. So, as we're coming to the end of the discussion today, I think for everybody sitting in the room thinking, wow, this is impressive, but how do we start? How do we, start to navigate this journey? Anna, could you just share a bit on that?
So from an NHS perspective, obviously the national cleaning standards should all have been implemented by now. I know that probably, if I'm honest, they're not absolutely everywhere yet. And they're hopefully the standards themselves, the documentation and the support that's available through exemplar site programs will help people to look at having that support to implement. From a MediRest perspective, obviously we work with many clients and we can work either formally with a formal contract like we have with the 20 trusts that you mentioned earlier, or we do also have a MediRest focus program where we can provide you with sort of consultancy services if that's what you would like support with as well, and the hashtag will take you through to our contact details so you can contact us. But we're here to support in whatever small or large way that you want us to. I think the Exemplar Site programme is fantastic. It's a real testament to the work that the teams have done and the relationships that you can see here today. And it's really nice to be able to celebrate that by giving people that sort of accreditation and certificate. And I know that's what it was developed for, and how Emma and Phil, Emma Brooks and Phil Shelley feel about the whole programme. If you need any more information, we're happy to answer questions, or we're here afterwards if you'd like to call us and talk to us.
That's great, thank you. And thanks everybody for listening.